Today I'll be talking about dyspepsia. It is also called indigestion and is a very common gastrointestinal condition. The patients may have symptoms like pain in the abdomen or abdominal fullness during or after eating food. They may also have symptoms like vomiting, nausea, or pain in the belly region. If the patients have alarm symptoms like difficulty in swallowing, or there is passage of blood in the stools or in the vomiters, or if the symptoms of indigestion or dyspepsia they persist for more than 2 weeks, or there is unintentional weight loss, these patients should definitely go and consult a doctor, preferably a gastroenterologist, as soon as possible. What are the common causes of dyspepsia? Patients who eat too fast or too fat and too spicy meals, they tend to have indigestion or dyspepsia. Those people who drink alcohol or smoke or chew tobacco, they also have more symptoms of indigestion or dyspepsia. It's a very common GI condition. Also, patients who take medications like non-steroidal anti-inflammatory medications, they tend to have these symptoms of indigestion pretty often. Patients with certain GI conditions can have dyspeptic symptoms. These include gallstone disease, peptic ulcer disease, and gastritis, and sometimes patients with irritable bowel syndromes have overlap symptoms with indigestion or dyspepsia. How do you diagnose these patients with indigestion or dyspepsia? Getting tested is the key step moving forward. You should consult your gastroenterologist. He'll take a thorough history of the symptoms and the medications that you are using. Then he might order some tests like a ultrasound abdomen, complete blood counts or liver function tests, or sometimes upper GI endoscopy may be performed to make the diagnosis of indigestion. Endoscopy is basically a long thin tube with a camera and light is passed through the mouth and through your food pipe into your stomach, and this is a procedure which takes 3 to 5 minutes and is done on OPD basis, and your dyspeptic symptoms will be diagnosed by this test. What is the treatment of dyspepsia? So you need to consult a gastroenterologist and you have to give a thorough history, and after a diagnosis he'll advise lifestyle changes which are so very important. So we generally advise the patients to take small frequent meals, chew their meals properly, and take time to eat. So there should be also sufficient times between time interval between 2 meals. Also, we advise the patients to avoid fatty meals and spicy products, and to maintain a time interval of about 2 to 3 hours between the dinner and your sleep time. There are certain medications which we prescribe to our patients. These include antacids, which are available in form of liquid syrups. They have to be taken after meals. Then we have drugs like H2 receptor antagonists, which are also available over the counter. They are generally prescribed once or twice daily. And there are another very potent drugs by the name of proton pump inhibitors, which we prescribe once or twice a day to these patients. Most of these patients, along with lifestyle modifications, they respond pretty well, and the indigestion and dyspeptic symptoms they resolve.